my name is Dari. I'm 26 years old. I've been transitioning, well, medically like 4 years now, but socially about 6 years. And yeah, I mean, before COVID, I was in school, but right now I'm doing other stuff. But yeah, that's pretty much the gist of it. Yeah.
You know, it's interesting. I've talked to a few people recently who used COVID as a great chance to kind of reset their presentation and kind of deal with some personal
Yeah.
stuff around transition.
Yeah. So I had my surgery with Dr. Deschamps, and then I'm having another surgery actually at the end of this month. And yeah, it's like the perfect time for me to do this actually. It was really hard for me when I was in school actually. So yeah.
So give us a little overview of, you mentioned a little bit about your transition schedule. So when did you make the decision to have facial feminization, and sort of where did that fit in your transition overall?
Yeah. Oh, that was the first thing I wanted to do, but for financial reasons, I couldn't at the time. It was, I mean, a huge reason why I pursued my transition was because I found out about the facial surgery. I didn't, because for me, I would say my face was the biggest trigger for me by far than any other part of me, and that kind of held me off for a while. But I had no idea facial feminization surgery was a thing, and the more I learned, the more I was pretty persistent about my transition and how important it was to me. So it's not so for a while I've been knowing it since I've been transitioning, but to make the actual uh leave to have the surgery, it came down to financial reasons.
And how did you initially find out about facial feminization?
Oh, through Facebook, Reddit, I think. I forgot what the forums are called. It was just girls posting their before and afters, and I was really amazed. I had no idea that was the thing, and it really did change my whole perspective and my transition. Yeah, because
Yeah,
since
yes.
puberty, my face has been since puberty, my my face was always a big problem, and I'm just glad it was out there. Because when it comes to surgeries, you always hear about the top surgery and the bottom surgery, but facial was everything. It was never a thing I knew about, like growing up as a teenager or kid. So it was really, I'm really glad I found out. I'm not sure exactly how I found out, but it was just, I know it was before and afters, like just scrolling online, like through forums and like different websites.
Now, once you found out about it, were you considering more than one surgeon, and how did you come to your decision about who to go to?
I I guess it was based on before and after that I saw online, but I wasn't really set on a specific surgeon. So Deschamps-Braly was the last consultation I had, and before him, I had about 10 consultations. Actually, I had a lot of consultations, and but once I had the consultation with him, I was really set and motivated to get my surgery with him. He was really professional. It was really nice. He had the before and afters, and more importantly, I was really comfortable with him, which is not something a lot of the other surgeons offered.
So since you had so many consultations, I'm kind of curious, how would you describe the range of experiences that you had? You mentioned a little bit about why you made your decision, but I'm just curious what the differences is for someone who's considering it and what they should look for.
Definitely before and afters, their history, and if that fits you, if the before and afters you see from that doctor fit you the most. But besides that is really being comfortable with the surgeon. And that's really important to me. I mean, I'll say those two things were the most important for sure.
And can you
And
walk
I mean,
someone
it's hard to
through?
say.
Oh, sorry, what were you saying? It's hard to
Yeah,
say.
it's hard to say. No, it's hard to say how comfortable you are with a doctor. I mean, you just have to have the consultation and actually experience it.
So can you walk someone through what it's like to have a consultation at Deschamps-Braly Clinic?
Well, Deschamps-Braly, I already had like my questions, like I already knew what I was looking for, and I already knew his before and afters were really good. So I was like pretty prepared for his consultation. But like my earlier consultations, I had no idea what to ask for. I had no idea what I was looking for. I just knew I wanted a girl face, not a boy face. But for Deschamps-Braly, I can't recall the question specifically, but yeah, it was just how exactly would my face look with certain procedures after they're done. And yeah, his complication history, how long he's been working, and of course his credentials and stuff like that. But a lot of that stuff was answered online, I already knew ahead of time. So
So
yeah,
kind of,
it was mainly personal to see how exactly would I look like and what does he think.
and so does he show examples, like computer generated examples, or how does he describe what you're going to look like?
Yeah, Deschamps did like a 3D imaging. Like I could be wrong. I think it was Photoshop, but I could be wrong. But he uses some sort of application, and then he shows you how you're likely to look like after your surgery. And yeah, I think that's his main method. I mean, he also like does some. He touches your face and like try to show you, and he measures your face and whatnot. But for the most part, the actual image is what pops out to me.
So once you had the consultation and made your decision, what was the timing from then until you actually had the
So I used insurance for Dr. Deschamps-Braly, and actually was not insured before my consultation. During my consultation, I asked if they take insurance, and I was pretty persistent in finding and being covered with what they usually cover for their patients. So I got a job for that provider, and then as soon as I got insurance that same week, and as soon as I got that insurance, I paid the deposit for the surgery, and I just scheduled the first date they had for the surgery because I just wanted my surgery as soon as possible, and it all happened within 3 months, which is pretty crazy.
That's great. Yeah.
Yeah,
So insurance is one of those tricky things that I think a lot of people have questions about. So can you
yeah,
describe a little more, like, how did you find out what carrier would cover it, and a little bit about how you
well,
got employed?
yeah, well, I asked Robin, which is who deals with the insurance and payments with Dr. DB, and I was just talking to her specifically, what companies and what insurances specifically have you guys had success with? Because that's what I want to go for. Because if I don't go the insurance route, then I'm going to be saving for years, and it's been really hard to save because I've been trying to save before that consultation. It's just been really slow progress. But yeah, I mean, I asked Robin, which works in his office.
When I was doing it, it was entirely out of pocket. So it's really great that things have changed a bit. So someone like
Yeah,
you can get it covered. So
yeah.
so so it was about 3 months after you had your consultation, you go in. And can you describe, just for people who are curious, what it was like from the time you got there through the actual surgery day?
Like got there like to my pre-op appointment or
Yeah,
like to
yeah.
the
So
hospital.
yeah, just to help people understand what the process is like, and how you
Yeah.
felt, and that kind of thing.
Well, everyone's different, but I was really excited. I had no anxiety. I was just excited. I was impatient. I was so happy. I was just happy. I was not anxious. I was not depressed. I mean, everyone's different, and everyone's experiences are I mean, they differ, but since I really trusted Dr. Deschamps-Braly, the office and everyone in the hospital, is that I was just excited because I already knew my results were going to be good.
Yeah, it is a bit of a leap of faith. And once you get
Yeah,
there, you have to be willing to put yourselves into their hands because they're the expert, and let them make the decisions. I think you're going to get the best results. I know a few girls who've gone in and said, oh, I want this nose or this chin and this person's forehead. And
Yeah,
I don't think that's the way to do it myself.
I never did. I know. I 100% agree with you. I didn't go in there asking him for a specific set of features or how I wanted to look like, because I trusted him. I knew he was gonna do a good job. So I pretty much just told him, just do whatever you want, and he gave me the procedures, and I agree with everything he listed. And I was not gonna contest or fight him about anything, because he's the expert. He knows what he's doing. And I know everyone's different, but that was my opinion and my viewpoint. So I was not gonna contest what he was gonna say, because and I agreed with everything he said anyway. So it worked out, you know.
So when you went there, did you go with somebody or were you by yourself?
No, I was by myself. It was COVID, so it was before the vaccine. So I was really worried that I would uh, get test positive, and then if that tested positive, my surgery would cancel, and I have to postpone it for who knows how many months. So I was really adamant coming by myself and doing everything by myself, because I did not want to get infected with COVID and have my surgery canceled. That
Did
was
you
my big reason
feel
doing
did
it
you
by
feel
myself.
that it was difficult to be there by yourself, or what were you able to manage that?
Uh, I would say I managed it for the most part. There was a few days where I felt a bit lonely, but I would say just the excitement of finally getting the surgery was really didn't didn't impact me that much, because I
So
saw my results almost instantly, and that that was enough for me to just stay positive, I would say.
so that's a good segue into my next question. So you
Yeah.
have the procedures, you go in that morning, and how are you feeling? What is that day like for you? Do you remember much of it?
Oh, the day after you're done with the surgery?
Yeah.
Oh, just nausea. It's just, I mean, there's no way to describe it. It's just, you're just nauseous and you're weak and you're tired. You kind of want to just be sleeping all the time. And I, I for the regarding pain, I did not experience any pain for the most part. I don't remember any pain, to be honest. It was just nauseous and feeling really tired for the most part. And just as the days progressed, it got better and better, I would say.
Yeah, that's a surprising thing, I think, for a lot of people, is that I don't really remember too much discomfort either. I think
No,
the thing for me mostly was it was annoying because my nose, I couldn't breathe out my nose. And so
yeah.
swallowing and things like that was a little tough, but it didn't hurt.
Yeah, the surgery looks really brutal, like from the images, but the pain is it's non-existent. At least for me, it was non-existent. I guess the breathing can be problematic, but I, I don't know, I forgot what they said. I guess just breathe through your mouth, and I don't know. I almost forgot what they said, but yeah, just breathe through your mouth and you should be good.
And so what all did you have done?
I had type 3 forehead. I had a rhinoplasty, genioplasty, jaw shave, I had cheek augmentation via fat transfer, and I think that's it. I'm not sure if you could see my side profile, but
Oh yeah, that's lovely. Very nice.
yeah, I had a very prominent forehead. That was my worst part of my face before. Yeah, but I think that's all the procedures. Oh yeah, and a brow lift.
Did you
Yeah,
do a trachea
the only
shave at
thing.
that time?
No, I still have mine, but it was kind of small, and we both agreed it was not a big deal.
Tell me what it was like when you got the bandages off, and could you see the results then, or did it take a while? Like describe what that was like.
Well, I saw the results as soon as I woke up, actually. I saw my forehead flat, and I saw my nose more what do you call it? It was more of it just didn't look like curvy, I guess. And I mean that was my main concern from the beginning, was my nose and my forehead. And you can see that instantly, because they put the bandages after I left the hospital. So it was kind of So I already knew what my results looked like. And as soon as I woke up, I recorded how I looked like. I knew I saw a big difference.
And how did you feel
And most
about
of my swelling was in my, how did I feel? Well, like I said, it was physically I felt nauseous and tired, but mentally I felt really great. I mean, I have videos of when I recorded myself when I woke up in the hospital, and I was really happy, despite the physical tiredness and nausea.
So can you describe for other people what the recovery process was like? Like how long would you say it took until it really, yeah, everything felt settled in your jaw, for instance?
Yeah, I recently saw Dr. Deschamps-Braly, and he said I still have some swelling in my chin and jaw. I don't see it, but I mean, I guess I still have some. But for the chin and jaw, I would say most of it disappeared by 2 months. And the swelling around the nose and the forehead is pretty much gone within like a week or two, actually. So it's not that bad. The swelling is really bad for the chin and jaw, I would say. But that for me went away for 2 months. But as long as you follow their instructions, which is like a low carb diet and or low sodium diet, the swelling should be pretty good. I mean, I talked to other girls who follow those directions, and their swelling is pretty good too. It's not too much.
Yeah, I think that's one of the things he does that's really innovative is really making sure that you don't get too much swelling, because that's what really causes
Yeah,
recovery to take a while. I know that for a lot of us, he has people get up and walk around almost immediately.
yeah. I remember that. As soon as like 30 minutes within waking up, I had a nurse who was trying to walk me around. It was a bit difficult, but since the procedure is kind of long, but yeah, I yeah.
It's funny too how,
They got
you
me
know,
walking around pretty quickly.
it's funny how quickly we forget the recovery and just kind of it becomes
Yeah,
our life too, right?
yeah. I mean, exactly. I mean, I had no idea what to expect for the most part, but it was pretty simple. I mean, it's easy for me. I mean, I don't want to speak for everyone, but it was a good experience for me. Like in every aspect, it was really good.
And how much time did you take off of work, and what was it like going back to work?
Uh, I took off about 6 weeks, I believe, and I was allowed 4 weeks, or the doctor wrote me a note for 4 weeks, but my job gave me no issues for another 2 weeks. So I took it just because I didn't want to push myself too much. I really just wanted to heal as good as possible. And returning to work, uh, it was pretty. I mean, since everyone's wearing a mask, I guess it was not a huge difference since my face is covered up regardless. So I guess it was good and bad in some ways. I mean, good because people didn't have to see my swelling, but bad because only I could get to see my results, no one else.
And you were already out at work before you had the procedures, right?
Oh yeah, I've been like full time before, long before, but it was harder for me to be like out there and positive because my face, because I would be like misgendered and stuff. It just took a toll on me eventually, like the more I transitioned.
And since the surgery, what has been your experience with interacting with other people? Like, how do they respond to you differently now?
It's hard to say because of COVID and the mask. It's really hard to say yet. I mean, I could say that I smile more for sure, and people interact with me more, but it really depends on the location and the people, I would say, because we're still in the pandemic, so it's people are still wearing masks and stuff like that. So my situation might be different from others.
Sure, sure. It's, yeah, it's such a weird time for all of this stuff. But
Yeah.
so how would you say overall it made you feel about yourself?
Oh, like confident level, or
Yeah,
in what way? Oh,
yeah,
I'm way
exactly.
more confident for sure. Way more confident. I'm not as depressed. My life has really changed, and I cannot thank my doctor and the whole staff enough, like really. It really changed my life, and I already knew it was going to change my life because it was always such a big problem with me for me since puberty.
And so what advice would you have to someone else who's trying to decide when to do this in their transition, who to go to, like making that decision? Like what would you recommend for someone else to consider?
I would, for the timeline, I would say at least a year. I would probably recommend 2 years because I remember my face did look different between pre-hormones, 1 year and 2 years for sure. A lot of my fat went towards my cheek areas, and that really did change my smile and my face a lot. And I mean, I'm not sure. I mean, that's everyone's different, and I know it's some are more urgent than others, but I would recommend at least a year, 2 years at most, if your situation is really urgent to get the surgery. And what was the other question?
Oh, I was just trying to sort of figure out where it was in your transition. So for instance, with facial hair, where were you with dealing with that?
Oh, I got rid of it before my hormones for sure. I started doing electrolysis long before my hormone treatment, and it's it's been a long process. It's hundreds of sessions. Well, it depends how much hair you have, but I had like a full beard, so it took a lot of time and money for sure.
Yeah, yeah, that was the hardest part for me was, and I've always tell people they should start as soon as possible because it was
Yeah,
about 400 hours for me. Like it was a lot.
yeah. I'm probably over 100, and I still go back there here and there to get some of the hairs that regrow. But for the most part, I'll say I'm done with my facial electrolysis, which is good because it's very time consuming and painful.
Yeah. So as far as how would you describe the offices when you go into the consultation? Like what is the sense when you go in compared to some of the other places that you visited?
Oh, how it was for Dr. DV, like walking into his office. To be honest, it was a bit intimidating because his office is really nice. It's not really it looks very high class, and I'm not like that. But but in the end, I was there for with one goal, which is to get the consultation, get his recommendations, get the quote, get answer and ask every question that I needed. And yeah, and just my goal was to just focus on the surgery. But I mean, his office is really nice. His staff is very nice. I mean, everything's perfect. I mean, I'm not intimidated anymore going to the office, but the first time I didn't know what I was getting myself into. 'Cause- but at least for his consultation, from the outside, it looks a bit intimidating. But once you start talking to the staff, it's a really good experience, I would say.
Well, that's one of the things that I feel, I think he's got a bit of a mystery about him. So it's always
Yeah,
great to kind of, I think, help other people understand what he's like as a person. So how would you
yeah.
describe him as a person?
Oh, I love his well, because I love music. He loves music. So that's my biggest thing with him. But talking to him, he's really nice. He's very honest, which is the most important part as a surgeon. He's really honest, and I mean his staff really makes up part of his whole office too. I love his staff too. They're easy to talk to. They're professional. They answer all your questions. They're accurate. I mean that helps too for sure.
So it seems like it was a really great decision for you. And I
Yeah.
know it was certainly a great decision for me too. Um, what other advice would you have for someone who's considering transition, just in general, in terms of, what might nudge them towards making a decision that's right for them, or just maybe they're not quite sure about the leap of faith you have to take? Like what would you say to sort of inspire or motivate somebody to take the steps they need?
Definitely take your time. Don't let anyone push you into deciding what's right for you. I mean, it took me time. I didn't start my hormone treatment until 2017, and I wanted to transition since 2012, since I turned 18. But it took me time, and I do regret not starting earlier. And I think a lot of girls agree with that.
I think almost
But
everybody thinks that way. Yeah.
yeah, yeah. But but I'm glad that it came to what it came to, because I'm really happy with my transition so far. But to make that leap, it's really hard to say. Just take your time and just surround yourself with other experiences and just try to be educated with what you're getting into, I would say.
Yeah, I think you said it a couple of times that, we're all on our own path with this, and nobody else's timeline is yours. And if you're trying to compare
Exactly.
yourself to other people, I think you're setting yourself up for disappointment. And that
Exactly.
that when the time is right, you'll know. And having a good plan in place and really doing your research, I think is really critical. And
Yeah.
so now that you're basically on the other side of things, like just again to sort of help people feel good about, thinking about this and making plans, like how are you feeling about things overall?
Like my transition in just life, or
Yeah. Yeah.
I feel I yeah, like I said, I feel really great. I feel really regretful I didn't start this earlier. I feel content with my body, which is the most important part. I feel really content. I feel really aligned with it. It makes my life makes sense. I'm not depressed anymore. I'm not suicidal. I'm actually I actually look forward towards the future. And it's just the most important part.